Hello everyone, welcome to sqadia.com, and now we will start our section 4 of the lecture topic Urogynaecology, in which we will talk mainly about the treatment of stress incontinence. So in the treatment of stress incontinence, we will go over the different treatment options of stress incontinence, in which we will talk about preventive and definitive treatment, and then some drug therapy and surgical options for the stress incontinence. So for the treatment, our treatment can be preventive and definitive treatment for the stress incontinence. For the preventive measures, we already went over what are the different risk factors or conditions that can lead to the stress incontinence. So prevention of those risk factors can lead to prevention of stress incontinence to some extent. One was the injury during the delivery, and then we have obesity can lead to stress incontinence. Then pregnancy can lead to stress incontinence. Some patients who have diabetes can lead to stress incontinence. So if proper management of all these conditions can lead to prevention of stress incontinence to some extent. So avoidance of, if you see here, avoidance of childhood trauma, any delay in second stage of labor can prevent stress incontinence. Proper management of diabetes can prevent stress incontinence. Then neurological diseases which can lead to stress incontinence, proper management of those. Then chronic pulmonary disorders that can lead to coughing, and which can lead to increased abdominal pressures that can prevent the stress incontinence. So in the definitive treatment of stress incontinence, usually this can be achieved by the surgical method, which can lead to strengthening or restoration of the muscles of the urethrovaginal junction, and then if there is strengthening of the support of the urethra, which is achieved usually by the surgical means or by conservative means. So treatment, preventive, definitive. Preventive is usually by prevention of the causes that leads to stress incontinence, and definitive treatment is usually by the surgical methods that can lead to prevention or treatment of the stress incontinence. So drugs and then different surgical methods that can treat the stress incontinence. Drugs are mainly sympathetomimetic drugs, which include alpha adrenergic drugs, in which commonly we have ephedrine and imipramine. Imipramine 15 to 30 milligram twice a day, 2 times a day orally, and then ephedrine 15 to 30 milligram again orally twice a day. So the drug treatment of stress incontinence are alpha adrenergic drug, which are imipramine and ephedrine 15 to 30 milligram twice a day. Then the surgery we have procedures like cystourethrogaphy. Plasty is the repair. So cystourethro, repair of the bladder and the urethra. Retropubic cystourethrogaphy. Paxi again is procedure used to Paxi is bringing to the normal position, so cystourethropexy. Then the third procedure commonly is tape procedure, in which tape is inserted to tightening up of the urethra to the pubic bone. Then again, sling procedure and salvage procedures are performed for the treatment of stress incontinence. In this cholecystourethrogaphy is the repair of the bladder and urethra, and in this usually the internal sphincter of the urethra is located, and then there is repair of the sphincter of the urethra that becomes very relaxed, and they have it becomes open, so there is incontinence of the urine. So in this procedure there is repair of the internal sphincter of the urethra. Then in retropubic cystourethropexy, usually it can be performed. This is the pubic symphysis pubis, and it can be performed by three different procedures. In this, the A procedure, this is the hair. This gives you the procedure in which the colpo suspension is done by this colpo suspension by Birch operation. There, A here, colpo suspension by the Birch operation. And then this B, this is the MMK procedure. MMK procedure. MMK stands for Marshall, Marchetti, and Krantz procedure. Marshall, Marchetti, and Krantz procedure. MMK. And then C is colpo suspension, in which white line of fascia is here used. Colpo suspension. See, this is the white line of fascia. In this, all these, there is strengthening of the pelvic floor by attachment to the Cooper's ligament. Cooper's ligament. So in retropubic cystourethropexy is usually there is strengthening of the pelvic floor, and there is strengthening of the pelvic muscle done. Here, if you see, this is tension-free mid-urethral tape procedure, in which the tape is inserted, and here the urethra is lifted too, so it can hold more pressure. So in this, the vaginal tape procedure showing the retropubic and transobturator placement. The tunnels are seen for each procedure. The tape is left under the urethra without any tension. So here, this is transobturator tape. Here, these are the obturator openings in the pubic bone. So tape is inserted below the urethra and then through the transobturator tape, and then we have transvaginal tape. This is transvaginal tape, and both of these are in this. The tape is used to elevate the urethra, and then so it can hold pressure better. Here, this is the transvaginal procedure, tape procedure with the needles inserted. So, needles in position, tape is left under the urethra here like this. Then this is the sling procedure, like the tape procedure, These are the these are the obturator holes inside the pubic bone. This is the bladder neck, bladder, and then the urethra. In this, instead of tape, the sling is attached below the urethra to increase the pressure, and this is the transobturator through the pass through the obturator bones, and it is the urethra is elevated, or it is held by the sling to hold the pressure. Then this is the salvage procedure, in which the artificial pouch is created, and this pouch is made from the portion of the intestine or a portion of the bowel taken to make a pouch, and then there is a catheter opening here. So the pouch is created to hold the urine. Here, if you see, this is the inflatable cuff, and in the scrotum there is hand control pump, and then once the button is pushed on the pump, then the process of micturition takes place. This is the reservoir for the urine. So the total artificial system for urination is created. Reservoir, it can be a plastic system, or this can be an artificial pouch created from a piece of the bowel system. So here, artificial reservoir, and then there is an inflatable cuff, and then we have the hand control pump. Once button is pushed, then patient can urinate. So all these are the procedures performed to treat the stress incontinence or problem in the urinary system. So thank you for watching sqadia.com.